Finally tonight, every 90 minutes someone dies waiting for a potentially life-saving organ transplant. The scarcity of donor organs raises difficult questions. Which patient should be helped first, and what about the daunting cost? A case in California has caught our attention, which highlights the debate. Here's ABC's Judy Muller.
Oh, you want the smaller one, probably?
Thousands of Americans are waiting for a heart transplant. For those fortunate enough to get a donor heart, the results can be miraculous.
There's nothing like it in medicine. It's someone who's clearly end stage, going to die, and being brought back to life. It's really an amazing process.
But there aren't enough hearts for everyone. So who deserves to go to the head of the line? That question became national news recently when a California prison inmate received a new heart at the prestigious Stanford Medical Center.
When I heard that this guy over in prison got that heart, my donor card came out of my wallet into the trash. And
the procedure, which cost hundreds of thousands of dollars, prompted outrage, in part because it was paid for by the taxpayer.
Flood of outrage. Several shows, people furious that this prisoner would get preference over a working stiff, a normal civilian who needs a heart.
But back in the 70s, the Supreme Court ruled that prisoners have a constitutional right to equal medical care.
This individual is serving a 14-year sentence for robbery. He wasn't sentenced to death. He was sentenced for robbery.
The decision on who gets a heart is based strictly on the greatest medical need of those on a national waiting list. Social worth is not an issue.
But everyone is treated the same once they get on that list, and no one is treated differently, and that patient was not treated differently.
Every civilized country provides health care to their inmates. The problem is all the other civilized countries guarantee health care for all their citizens.
And there's the rub. In order to get on this list in the first place, the patient has to have insurance, or in the case of the prisoner, the state picking up the entire tab. Frank Salgado, diagnosed with congestive heart failure, has neither. Without a new heart, he will die.
We'd try to get financial clearance for the transplant, and the insurance canceled me, my wife, and 2 kids.
He was told he would have to raise $150,000 to even get his name on the transplant list. He did that essentially by begging for money through fundraisers. The news about the prisoner's transplant stunned him.
I paid taxes over 20-something years, been a good citizen, a good person in the community, and I don't qualify for any help at all.
There are no provisions in your policy for a procedure of this magnitude.
Oh, no. That's a mistake. I mean, I'm insured. My son's covered.
The recently released movie, John Q., has focused public attention on the problems of the uninsured who need transplants.
What are you doing?
I'm taking your advice. I'm not taking no for an answer back.
My wife and I were sitting in the theater together, and the trailer came on, and we just looked at each other. We were in shock. This is our story. I mean,
Salgado jokes that perhaps he too should commit a crime, robbing a bank, for example.
If I get caught, I'll go to jail. And because I need a heart transplant, they have to take care of me, and I'll get a heart, and it'll be paid for.
Which raises a question. How many organ transplants and other state-of-the-art procedures can the taxpayers afford?
The real tsunami that is going to hit all of us, whether it's the state of California or any other state, is the reality that we have an aging prison population just as we have an aging overall population, and the costs are going to continue to increase.
Despite the uproar over the prisoner's heart transplant, there is one family that does not begrudge him that second chance at life.
You hear about prisons and you hear about inmates. It's all so far removed. But when you're in a room with another human being, it's a person.
Cheryl Morelia's husband, Mike, shared a hospital room with that prisoner. They were both waiting for a heart. Because Mike had just undergone another procedure, the donor heart that became available went to the prisoner.
We had waited so long, and had Mike not had that LVAD surgery that day, that heart would have been his.
But her husband never resented his new friend's good fortune.
I showed him a newspaper clipping, and it said, transplant for prisoner brings up question of ethics. And he looked at it and he goes, what, are they kidding? Since when is it unethical to save someone's life?
Which is exactly why objective medical criteria take precedence over subjective judgments.
Then you get into that very murky area of social worth and trying to value one life over another, which we've all agreed is not possible.
For the more than 4,000 people on the national waiting list for a new heart, these issues are not academic, they are critical. Some 700 people die each year while waiting for a donor heart. Mike Moralia finally got his donor heart. He has insurance to pay for the expensive follow-up care. Frank Salgado is still waiting, and he is still uninsured.
Every day I worry about my wife and my kids. You know, I grew up without a dad, and I'm not ready to leave my kids and my wife.
Judy Muller, ABC News, Palo Alto.